Thursday nights now look like this, as the nation pays tribute to NHS and care workers. But for those on the front line who are also immigrants, many have to pay an annual fee to use the NHS, even if they work in it. Currently, the NHS surcharge is £400 a year for migrants outside the European Economic Area. That figure will rise to £624 in October this year, and after Brexit, it will apply to all migrants, including those from the EEA. But over the last few days, the Prime Minister has come under pressure to scrap the surcharge for NHS and care workers. In the Commons yesterday, he resisted that pressure.
We must look at the realities that this is a great national service, it's a national institution, it needs funding, and those contributions actually help us to raise about £900 million. And it's very difficult in the current circumstances to find alternative sources. So,
according to the Institute for Fiscal Studies, an exemption would actually cost around £90 million, 10 times less than Mr Johnson suggested. And at today's Downing Street press conference, a change of heart.
The Prime Minister has asked the Home Secretary and I to work on how we can remove NHS and care workers from the NHS surcharge as soon as possible. And I'm very pleased to be able to do that. I've already spoken to the Home Secretary and we'll be saying more on how we do this in the next few days.
One of the people who will benefit from the change is Chantel, a care worker from Jamaica who has lived in the UK since she was 7 and has spent nearly £10,000 on the surcharge.
I'm still struggling now. I still owe things from the last time I paid for this application. I can't use my credit cards anymore because I'm still paying for those. I've already paid taxes, so why do I have to pay NHS surcharge? It's like I'm paying double tax. People like I'm not worth anything. I'm just here and, you know, I'm not valued as a person. But I'm doing a lot. I'm on the front line. You know, I'm risking my life. So I'm putting myself out there to help people.
As we were doing this interview, the news of the exemption broke, and this is what it meant to her.
Really? Yeah. Thank God. Yes, you just saw it. Oh my God! Oh my God! I just saw it on the news. It says going to exempt it. I'm like, yes. That's really good, Chantal. I know.
It was also welcomed by the Labour leader.
It's the right thing to do. We can't clap our carers on a Thursday and charge them to use the NHS on a Friday. So he's been challenged. I asked the Prime Minister to reconsider. He's done that, he's U-turned. This is a good thing, a victory for common sense.
Common sense or political pressure, whatever the cause of the change, it will finally provide health and care workers with support beyond just clapping.
And Liz Bates is with me now. So what brought this?
So I think today what potentially brought this on is that lots of senior Tory MPs have been speaking out against Boris Johnson's position as he set out in the Commons yesterday. I spoke to one of those MPs, Roger Gale, who said that lots of Conservative MPs were becoming hostile to what the Prime Minister had said. And so a potential rebellion on his hands, that could be what has led to the change in direction today. It's also worth noting, just for context, that the Conservatives have a manifesto commitment to clamping down more widely on health tourism, including raising the surcharge. And so today's announcement doesn't mean that they've dropped that policy, but it does mean that it's sort of slightly dented. So that could account for the delay in this change of direction. And finally, politically, it's important probably to note that this U-turn today comes on the back of one yesterday from Priti Patel on the potential deportation of NHS, of people who work in the NHS, their families. So 2 U-turns in 2 days, that could usually mean that a government is losing control of the political narrative. But of course, we're not in normal times. This is a pandemic and the world is changing very rapidly. Hardly surprising then that government policy is also changing very rapidly.
Thanks, Liz. Well, I'm joined now by Dame Donna Kinnair, who's Chief Executive and General Secretary of the Royal College of Nursing. You've been calling for this for a long time.
Yes, we have since its announcement in 2015. But for the last 2 years, our members across the health and social care sector have been very clear that this is an unfair tax.
How do you feel then about the fact that it's taken this, the coronavirus crisis, and perhaps the Prime Minister being in hospital himself, to make the difference?
Well, I welcome the news on behalf of nurses across the health and social sector divide. But it is really a shame that it's taken this pandemic for the government to see sense. As a daughter myself of the Windrush generation that came here to nurse and also to provide support to the public sector, it is very, very clear to me that this was an unfair burden on people that were already paying taxes and national insurance. But I think there's one bit of caution with this. We can only breathe a sigh of relief when we hear the details of how this immigration surcharge is going to be lifted. And what we don't want to see is it taking a long time, because actually we're clapping now, we're seeing nurses step up to the plate right now, and we need something done about this now.
I mean, obviously there is a particular sharpness about the idea of a health worker currently saving people, then paying this charge. But the principle of people who are already paying tax and national insurance then paying the NHS surcharge as well, if they're immigrants, remains for everybody else. Do you think the surcharge should be scrapped for everybody, or do you think health workers and care workers are a special case?
I think health and care workers are a special case, because they're the very, very people that are providing the care to patients, both in hospital and out of hospital. So it seems a bit trite, really, when we're charging them. They're providing care for our citizens and our patients, and yet we're saying to them that actually you too have to pay. And another thing that I've noted that people are saying is that they're paying to use. Many of our immigrants aren't actually using the National Health Service at this moment because they're often fit and very young people that are coming over to serve. So I think I recognise that as a daughter of Windrush generation myself, they came over to serve the NHS and public sector, and it is an unfair tax burden when the very thing that you're doing to support the country, you are being charged for if you happen to need it in an emergency.
Later on in this programme, we're going to be revealing the results of a survey that's been carried out on behalf of us, of ethnic minority health workers, with the particular concerns and fears that they feel around PPE and other measures in the health service. This is another issue you've been very vocal on. They're saying some alarming things about how they don't feel they have access to protection, they're getting frontline work to a disproportionate extent. Do you think this is something that is still not being gripped?
Well, certainly as the Chief Executive of the Royal College of Nursing, this is something I hear time and time again. In fact, even today on a call, it is a similar story. So I do think that care workers need access. They need access to PPE, particularly the BAME workers, so ethnic minority workers, and they also need access to testing. And I think that it is something, whether it's the fact that these individuals feel that they go unheard and really aren't given the chance to speak up. As the Royal College of Nursing, we are very clear that they need to have a voice in this, and they do feel fear.